All right, let's switch gears here. And services at the Mbagathi Hospital in Nairobi run the risk of being grounded due to huge debts owed by the hospital to suppliers.
Well, the outstanding bill is over 119 million shillings accrued over the duration of the administration of the Nairobi Metropolitan Services. Now, the hospital is also owed over 80 million shillings by the now defunct Nhif under the Linda Mama program. Well, these debts now mean that the hospital is struggling to offer premier services and complete pending programs. Brenda Wanga reports.
At the Mbagathi County Referral Hospital, patients, some treated and discharged, linger in the wards. The hospital administration tells us these patients prefer staying at the hospital than going home on account of the harsh economic times.
The discharges still in the ward, we call them discharge-ins, are 40. Total inpatient for the last 24 hours up to now, 457, against a bed capacity of 347. Yeah.
So you can see we're struggling. And my brother, what does it say about the state of the nation and the state of the economy? When somebody has been treated, he has been discharged, but he would rather stay in hospital than go home. Because they are saying the situation at home is worse than at Mbagathi Hospital. At least here, they are guaranteed that the doctor here will give them a meal.
The burden of keeping such patients here is weighing heavily on the hospital that is already straining with huge debts. The hospital owes suppliers over 100 million shillings, debts stretching as far back as the days of the Nairobi Metropolitan Services Administration.
There is a question of pending bills of 119 million shillings that is owed by the NMS to various suppliers when they were in charge of the hospitals at that particular time. We also want to say that it is a heavy burden on our facilities here to have that debt on our books, yet they were incurred by an entity that has now been declared defunct, and the people who are responsible for that again are the people at State House. So we want them to facilitate these hospitals to be able to pay all those debts out.
Indeed, the NMS debts aren't the only financial strains facing the hospital. The hospital is also owed over 80 million shillings by the Nhif through the Linda Mama program. The hospital, which has a bed capacity of 452 people, is currently handling nearly twice that amount of patients on a daily basis. An expansion program that will see this capacity improved stands unfinished, as the hospital cannot afford to pay the contractors to complete the works that would also increase the hospital's capacity to handle emergency and critical care services.
We are being told that Nhif owes this facility alone 85 million shillings in unpaid remittances. So we want to also urge that Nhif needs to release this money so that we can continue some of the programs we are going on, what we are doing here.
The Nairobi County government, now in charge of running the health facility, acknowledges the challenges facing the institution, including the pending bills and delays in paying health workers' salaries. Nairobi County Secretary Patrick Analo, speaking to Citizen TV, says the debt does exist and is being audited by the Office of the President with the view of handing over the same to the county government. At the same time, the county says it is in the process of clearing January salary arrears. The county further states that the hospital's capacity to handle and dispense medicine has been improved with the contracting of KEMSA to supply it with medical equipment and drugs after clearing its 240 million shillings bill with the supplier. Brenda Wanga, Citizen TV.